They told the men they were getting treatment. They called it bad blood. What they did not tell them was that no cure was coming. What they did not say was that the government had decided to watch, not to heal, not to intervene, but to let a disease finish its work on schedule. The files make that clear. In Macon County, Alabama, in 1932, the U.S. Public Health Service opened a study with a title that reads, "Less like medicine and more like a warning." The study of untreated syphilis in the Negro male. It began as government medicine. It became government observation. And it ended as government neglect, carried out over 40 years. 600 black men were enrolled. 399 had syphilis. 201 did not. Most were poor. Many were sharecroppers. And informed consent was never collected. The men were not purposely infected. They were recruited because they already had syphilis. But deception does not need infection to become lethal. The cover story was simple and effective. Researchers told the men they were being treated for bad blood, a local phrase that could mean anemia, fatigue, and unspoken syphilis. In exchange, the men were offered free medical exams, free meals, and burial insurance, a benefit designed for the end of life, not the preservation of it. The stated purpose of the study was to observe the natural history of untreated syphilis, not to cure it, not to prevent it, to watch, to record, to publish. And syphilis is a patient killer. Left untreated, it can damage the heart and blood vessels. It can invade the nervous system. It can disable slowly, quietly over years. While the outside world assumes a man is simply getting older, this is where the dread lives. The study did not require a secret prison. It hid in plain sight. It operated inside a rural health system during Jim Crow, a system where power already moved in one direction, and where questioning authority carried consequences. At first, the timeline reads like routine care: appointments, blood draws, periodic checkups, a government stamp that made the entire operation look legitimate. Then the world changed. By the 1940s, penicillin became the standard treatment for syphilis. A cure existed. It was effective, and it was widely available. Inside the study, that cure became a problem. Because a cure ends observation, it collapses the experiment. And when data depends on human decline, compassion becomes contamination. Participants were not offered treatment, even after penicillin became widely available. That single decision is the hinge of the entire scandal. It turns neglect into policy, and it reveals intent. The harm did not stop with the men enrolled. Because of the lack of treatment, some women contracted syphilis from participants in the study. Some children were born with congenital syphilis. A project designed to observe spilled into bedrooms, marriages, and families. People never counted, never compensated, never named. In public, the program wore a mask of benevolence. In private, it relied on imbalance. Risk flowed downward. Authority flowed upward. The harm was physical. The justification was paperwork. And the paperwork endured. The study ran from 1932 to 1972. 40 years. Long enough for a young man to enroll, age into illness, and die, while still listed as under observation. Ask what it takes to keep a study like that alive. It takes more than funding. It takes control over information, control over diagnosis, control over what a patient is allowed to know about his own blood. Even community awareness became part of the camouflage. Many in the Tuskegee community knew of the study, but believed it was a special government health program. Trust, earned through the authority of the state, became the lock on the door. Inside Tuskegee, the experiment kept its old vocabulary. Then one man refused to let it stay quiet. Peter Buxton raised ethical objections, and kept raising them. He warned that the men did not understand the consequences of untreated syphilis, and that the racial dimension was a moral and political fault line. In July 1972, the silence broke. An Associated Press investigation exposed the study to the nation, not through confession, not through declassification, through reporting. After the story broke, the government moved because it had to. An assistant secretary appointed an ad hoc advisory panel to review the study. The panel was asked a simple question: should this study have continued once penicillin was available? The answer was unequivocal. The panel concluded the study was ethically unjustified. It stated that the scientific value was minimal compared to the known risks. In October 1972, it recommended ending the study. A month later, the program was officially terminated. But ending a study does not undo its damage. In March 1973, the panel advised providing medical care to surviving participants. A health benefit program followed, care arriving decades late, like an apology written in prescriptions. Money followed. In 1974, an out-of-court settlement totaled $10 million, divided among living participants and heirs. It is a number that tries to sound like closure. It cannot buy back years without treatment. Out of the wreckage came new rules. In 1974, the National Research Act created a national oversight framework. Informed consent and institutional review boards became mandatory for federally funded research. 1979, the Belmont Report codified the lesson into 3 principles: respect for persons, beneficence, and justice. The principles are clean. The reason they exist is not. Decades later, the government finally spoke the sentence it had avoided. On May 16, 1997, President Bill Clinton issued a formal apology. He called the study clearly racist. And he said, on behalf of the United States, "I am sorry." That apology matters because it admits orchestration. Not a mistake, not a misunderstanding. A federal program that ran for 40 years without informed consent, while treatment existed, and while the men believed they were being helped. Tuskegee left a second casualty: trust. When a community learns that free care can be a mask, every clinic door looks different. Every public health campaign must fight an echo it did not create, but inherited. So the question at the end of this file is not only historical, it is operational. If the state can rename harm as research and keep it running for decades, what else survives today because it is wrapped in authority and protected by routine? This file is closed, but the next one is already open. Subscribe.